financial columnist for the Union and host of Money Matters on KVMR FM. And welcome to another edition of Investing Community, where we cover the amazing organizations, events, nonprofits, and today businesses happening in and around the county and bring them to you through social media. And today I'm again with the lovely Eileen Mello.
Hi, Mark. So today we're in Nevada City. We're going to be talking with Shauna White, who is a certified instructor for foundation training. And Mark, you told me a lot about this, so
Yes.
we're going to share with folks today.
Yes, I have. The story is I had some stem cell shots in the shoulders, which worked pretty well, and I went to get some stem cell shots in my back because I've been pretty athletic. And doctor stopped me and said, hey, before you do that, go see Shauna White of Foundation Training. And I thought it's another back physical therapy class. And he goes, no, this is entirely different. She put me through an 8-week class. The results have been more than I expected. So we're going to talk about all that. So we're going to talk to Shauna, and I think we're ready to go, right?
Very good.
All right.
Yep.
Ready to go.
Shauna White, thanks for joining us. And you are a certified instructor for foundation training. Can you tell us a bit more about it?
Yeah, thank you very much for allowing me to share this work. Foundation training is a movement practice that helps to restore the body's natural way of holding itself and supporting itself through the day. And this is unlike anything else. This is very different from physical therapy, very different from yoga, Pilates. It's pretty much in its own category. It's considered more of corrective exercise.
Okay,
Yes.
thank you. Shauna, tell us who benefits most from foundation training.
I'd say probably what most people find foundation training are those that have back issues, neck issues, shoulder and hip issues, that central core part of the body. People that are maybe looking at possible surgery or spinal injections, very invasive programs, that want to look for some kind of an alternative to that, especially drugs. Drugs are a very big problem right now and everything, with a lot of people getting stuck on opioids. And so it's a program that people can actually use, and that will help the back, help the neck, and bring everything back into alignment. When everything's back into alignment, then the body just works much more efficiently.
Right. So essentially a natural remedy for pain management.
And the natural remedy, yes, exactly.
Foundation training sounds pretty amazing. So what is it exactly?
Well, it's a movement practice, and what we're going to be focusing on is I'm going to teach people how to lengthen their spine naturally in a standing position or a seated position. We're going to stabilize the lower part of the body, which is very important. And we're also going to be using a very special breathing method called decompression breathing. And this is the heart and soul of this particular work.
And would you be willing to show us a few postures?
I'd love to.
Great.
I'd love to.
Okay. All right, so here's an example of what we're going to be doing in a standing decompression. So I've got Mark standing and with his feet, actually, we'll do this in a couple different positions, or with the feet together, right here, and we're slightly in the pigeonhole position. He's going to draw his weight towards his heels. He's going to push his toes into the floor. I want him to feel the pinky and the big toe and the heel, all to a tripod. And then push those toes into the floor so you actually feel this natural arch that actually starts to develop. And he's nice and in line. So his head's right over his shoulders are over his hips, right through here. And he's going to go ahead and take this big breath again. He's going to pull his torso, the front, back, side, all as one, lifting it up away from the anchored lower body. And then decompress by he's going to be pulling that navel in on that exhale, keeping lifted all throughout the upper part of the body. He's pulling his head back a little bit, but lifting up through the neck. So we want that extension through the neck as well as through the spine. Keep putting that weight back into those heels, right through there. Take a big breath in. Exhale, draw that navel in, keeping the height that you just created right through there. Great job, Mark. All right, so now we're going to go actually try another position called the founder. Founder is sort of a signature move in foundation training. All right, so we're going to start in that standing decompression position where he's got his toes together. We have different positions for the feet, but he's going to start right in this position again. He's going to dig his toes into the floor, feel that arch, which is part of the posterior chain that we're trying to actually work. And he's keeping his knees not soft. We don't actually lock any joints in the body. His weight's going to be back into his heels. Right there. He's nice and stacked really nice and properly. He's also got that neck actually involved in pulling back and lift it up. Good. Shoulders down and back. And again, we're going to breathe through the chest, not through the belly. Take a big breath in. Find that length first. Keep those shoulders down. And then we're going to pull the hips back towards basically our back wall. So just start to pull those hips back, while we're actually still anchoring the lower body and decompressing the upper body. Right through here, starts to build some tension into the low back. Right through. And he's going to take his hands forward into what we call a sphere of tension. He's going to push into those fingertips there. He's going to keep very broad and there, nice and long. Shoulders back and down, neck nice and lifted. Fully extension, so that way the disbursement of the force is all even from the tailbone all the way to the top of the head. And he's going to do his decompression breathing here. Take it high. Big exhale, pull that navel in. Good. Find a little bit of trembling. Again, weight back in those heels, hips pulling back, long, extended spine. Good. Big breath in. Exhale. Good. And then to relax, just bring those arms back down, bring the upper body up. Great job.
Thank you.
You're welcome. All right, so we have Mark here in what we're going to do quickly, a seated decompression. Okay, so he's in this position, his toes are in a slightly pigeon toe position, his knees are together, and he's going to actually press those inner thighs towards each other, activating the inner thighs as a big part of our core. Most people don't really realize that. He's seated nice and straight, and he's going to try to keep equal weight onto his tailbone, so he's nice and straight here. Good. Great. Pull that neck up just a little bit. There's that extension. That neck should be an extension of the spine. We tend to have just forward carriage a lot. Good. And we're broad through the chest. And we're going to do a couple of different arm positions. One we can just keep just like this. And just take that lift. I want you to sort of pull that front, back, side body all as one. Keep the chest elevated and just take the navel in. Actually draw towards the spine to exhale. Good. Let's take, Mark, take those hands in that sphere of tension, heart center. Keep very broad through here. Shoulders down and back, nice and open. And take another big breath. Filling up the chest, not packing it through the belly, so the belly stays nice and engaged the entire time. He's pressing into his fingers, actually creating tension, positive tension into the upper body that we're training to get back into alignment. Good. Beautiful. Wonderful. Great. Good job.
So today, I went through a few exercises. I'm very familiar with them from my 8-week class, so thank you. It's been a pleasure, and I understand you have a class coming up.
Yeah, I actually teach in various ways. I have ongoing classes, private sessions, and I have a 4-week series that's coming up that begins at the end of March and goes through April.
All right, so there you have it. Thanks for showing us around, and thanks for having me in your 8-week class.
Glad it was so effective for you, Mark.
So foundation training with Shauna White. What do you think?
Pretty cool. Already thinking of a colleague I'll have to introduce her to.
Yeah, like I said, I had little choices, and I was down to the shots. I wasn't going to get surgery, and it's worked, well more than expected for me. You got an idea what the exercises have been like. I've been through 8 weeks of it. It's hard to do for sure, but it's good exercise. So we'll have contact information at the end of this video. And again, once again, this is for people that have been out of options, maybe are on the pharmaceuticals or looking at surgery, or PT hasn't worked. So for me, it's worked rather well for sure. And she's a pleasure.
Absolutely.
Absolutely. Okay, that does it for another edition of Investing in Community, where we bring the amazing organization, events, nonprofits happening around the county and bring them to you through social media. If you'd like to send Eileen and I an email, you can do so at moneymatters@kvmr.org. My name is Mark Cunaberti.
I'm Eileen Mello. Thank you so much for joining us.
All right.